If you have knee arthritis and you go and see your doctor, research indicates that you'll likely be interrupted within 11 seconds. This is a problem because you have information that your doctor can't get from your knee x-rays or your MRIs. Hi, I'm Laurie Kurtz-Kelly, and I've helped thousands of active adults build stronger, healthier knees without surgery. And in this video, I'll share 13 questions I ask all my clients. When your knees hurt, what words do you use to describe the discomfort? If you use a word like stiff, I'm going to suspect that you may have a decrease in lubricant within your knees. This lubricant in the medical world is known as surface active phospholipids. Or if you describe your knees with words like full or tight or puffy, I'm going to suspect that you may have swelling within your knees. You might describe your knees with the word electrical. If you do, I'm going to ask you follow-up questions about your back because your pain may be originating from your spine. Perhaps you use a word like throb. If your knee pain is a throbbing pain, I want to know if it's vascular. It could be vascular in nature, or it could be swelling deep within your bones. Other insightful words include sore and achy. Most people who use those two words have some type of weakness inside their knees. And if you use the word sharp to describe your knee pain, I'll ask follow-up questions so I can determine if you have a very specific injury or a localized area of your knee that's affected. When did your knees first start bothering you? A particular trauma like a fall or a car accident or a sports injury can lead to persistent knee pain. But let's say there wasn't a trauma, there wasn't a particular incident. Then I ask the question, what if anything changed around the time where your knee pain started? A fluctuation in activity can cause persistent knee pain. So that fluctuation might include one of a few things. You might have increased the frequency of a familiar exercise, or maybe you've increased the duration of that exercise, how long you did that particular exercise. Maybe you increased the level of difficulty of the exercise, maybe like the speed of it, or how much, if it's running, doing it on hills. Same with hiking, more elevation changes, something with the difficulty changed within a familiar exercise. And or you may have started a completely new form of physical fitness. All of these, or a combination of these, can cause persistent knee pain, and even more so if those changes were preceded by a time where you were actually less active. Is your knee pain pinpointed or diffuse? If you use your fingertip to point to your knee pain, I may suspect a specific injury like a meniscus tear. If, on the other hand, you point to your knee pain with the palm of your hand and show me a larger area, then I'm going to suspect that you have weakness inside your knees, weakness in the surfaces inside your knees. You may have received a diagnosis like chondromalacia or osteoarthritis. Both diffuse pain and pinpointed knee pain respond well to the Better Knees method. You can find out more about this 3-phase method in the description below this video. Is your knee pain always in the same location, always in the same spot, or does it seem to move around? Knee pain that tends to move around can oftentimes feel a little bit confusing, but it's a very common occurrence among active adults who have weakness inside their knees, knee joint weakness. In this case, it's essential to first soothe your knee pain, then strengthen inside your knees, and finally strengthen your leg muscles. These are the 3 phases of the Better Knees method. How do your knees feel when you wake up in the morning? Knee stiffness first thing in the morning that improves as you move around is a hallmark sign of osteoarthritis or of arthritis. And how do your knees feel at the end of the day? If you have knee pain or discomfort that increases as the day progresses, most likely that your knees can't withstand an accumulation of forces that are being applied to them. These unacceptable forces may be sustained positions like sitting, standing, or kneeling, or they could be movements like walking, stairs, or standing up or sitting down on various surfaces. This is a topic I talk about during a strategy session, a zero-cost Zoom appointment to determine if the Better Knees method will work for you. What activities make your knee pain worse? I want to know which activities or exercises make your knees feel bad. So for example, examples might include things like sitting for a few hours or walking down a flight of stairs, or it could be pickleball or yoga. It might be hiking or running or lifting weights. Whatever it is, I want to know what makes it feel worse and kind of how intense that elevation or aggravation is. That being said, it's not always obvious what makes your knees feel worse. And there are a lot of people that work with me that prior to doing so weren't able to confidently answer that question. How long does the aggravation in your knee pain last? If, for example, you hike for over an hour and you have an increase in knee pain afterwards, does that irritation and knee pain last for 30 minutes or for the rest of the day or for several days? This is going to give me some insight about how sensitive your knees are. After a client starts working with me, they notice that those irritations, those aggravations in knee pain tend to go away, tend to resolve a little more quickly. And then gradually after that, they'll notice that they get the aggravations much more rarely or not at all. What makes your knees feel better? This may include ice or heat, rest or periodic movement, avoiding or performing certain activities and exercises. I'm also interested in whether you need oral medications, whether those are over-the-counter or prescriptions, topical creams or injections, anti-inflammatories or pain relievers, any of those things. I'm interested if you need to rely on them to be able to function well throughout your day. How long does the improvement in your knees last? Whatever you're doing to make your knees feel better probably only lasts a temporary amount of time. Maybe it lasts an hour, maybe it lasts the rest of the day. Perhaps it lasts until you do an activity that then creates the knee pain again. My goal is to help you build stronger, healthier knees so that your knees continue to feel good for many years to come. Describe your daily or weekly routine. Is this impacted by your knees? I imagine you want to be able to sit, stand, and walk without knee pain, but there's probably a lot of other things that you want to be able to do without knee pain. Some people want to be able to take multiple flights of stairs without giving it a second thought, and others want to play a particular sport. I want to know what your ideal day or week look like so that together we can build stronger, healthier knees that are resilient enough to withstand all the forces of your daily or weekly routine so that you can do that without having knee pain. Do you have aches and pains anywhere else in your body? While your knees may be what are primarily getting your attention, it's important that all areas of your body work together so that you feel great. Sometimes this means avoiding extra pressure on certain areas of your body, like your neck or your shoulders, maybe your elbows and your wrists. Other times it means strengthening your knees and simultaneously strengthening other areas that coordinate with your knees, areas like your lower back or your hips, maybe your ankles. Now that you know the 13 questions that I asked to help you build better knees, you're ready to watch my video, Best Exercises to Relieve Knee Arthritis Pain.